Symptoms of hypothyroidism: slower than normal heart rate, decreased bowel function, fatigue and exhaustion, slowness of movements and sluggishness, difficulty concentrating and brain activity, weight gain without a known cause, dry, rough and itchy skin, drying, roughing and thinning hair, feeling cold, especially at the end of the hands and feet, constipation, muscle cramps, increasing the number and amount of monthly bleeding, infertility or miscarriage. Symptoms of hyperthyroidism: increased heart rate, high blood pressure, excessive sweating, high heat intolerance, changes in bowel movements, weight loss, irregular menstrual cycle in women, increased appetite, getting nervous, restlessness, lack of concentration, muscle weakness, irregular heartbeat, insomnia, fragility and thinness of hair, skin rash, hair loss, nausea and vomiting, breast enlargement in men. Symptoms of thyroid dysfunction, hyperthyroidism and hypothyroidism. The thyroid gland may be small, but it carries out a list of very important tasks including regulating appetite, regulating energy levels and even body temperature. Feeling too tired and laziness or depression. Memory problems. Unreasonable weight loss. Unreasonable overweight, decreased thyroid hormone or hypothyroidism. Hand tremors. Hair loss. Getting nervous. Sweating a lot. Inflammation in the neck, swelling and enlargement of the neck. Increase or decrease heart rate. Anxiety. Sleep disturbances and restlessness. Feeling hot or cold. Dry skin, brittle nails, numbness of the hand. Constipation or diarrhea during menstruation. Vision problems. Irregular menstruation. Changes in skin color. Increase or diminish bowel movements. Swelling of the eyes. Checking the thyroid from the neck. With careful examination in the mirror, the enlargement of the thyroid is detectable. Then you should go to the doctor for a checkup. To do this test, hold your head back, drink a glass of water, and as you drink and swallow water, check the lower part of the snoring and the top of your collarbone. Look for bumps or protrusions. Then repeat this action several times. If you see such symptoms, be sure to talk to a specialist doctor. Ways to improve thyroid function. Many people with this disease suffer from excessive fatigue and brain fog, confusion, amnesia and lack of concentration. People use sugar and caffeine to relieve fatigue and gain energy. These two substances are very harmful and in addition to causing other diseases and fluctuations in blood sugar, thyroid function is also difficult. Consume less flour and cereals and use non-starchy vegetables. Use more protein such as nuts, meat and fish, eggs and legumes. Consumption of healthy fats such as olive oil and avocado, coconut. Vitamin D, iron, omega-3 fatty acids, selenium, zinc, copper, vitamin A and vitamin B. Flax seeds, walnuts, asparagus, beans, mushrooms, cooked spinach, sesame, garlic, beets, grapefruit. Sedative exercises such as yoga reduce symptoms of hypothyroidism by reducing stress and balancing energy and increasing metabolism. Thyroid is sensitive to radiation. To prevent thyroid-related diseases, use a protective collar in the dental office. Treatment of hypothyroidism. If you have been diagnosed with hypothyroidism, the first thing your doctor does is prescribe thyroid hormones that you get in pill form. The use of these pills will make a visible impact over several weeks. This treatment increases energy, lowers cholesterol and loses weight in the long run. Most people with hypothyroidism should use these pills for the rest of their lives. Natural treatment of hypothyroidism. Pour 2 tablespoons of coconut oil into some milk and consume daily at breakfast. Pour 2 tablespoons of natural apple cider vinegar into some warm water. Add some honey to it. Use the solution regularly every day. If you are taking blood-thinning medications, you can use fish oil after consulting with your doctor. The typical dose should not exceed 3 grams per day. Vitamin D. You can be exposed to sunlight for at least 15 minutes every morning. This helps you provide healthy immune function as well as calcium metabolism. Drop a few fresh pieces of ginger in boiling water and soak for about 5 minutes, then add some honey, and consume. Treatment of hyperthyroidism. The most common treatment for hyperthyroidism is antithyroid drugs that reduce thyroid-produced hormones. Hyperthyroidism may end eventually, but most of those with this problem should take medication for a long time. Other medications may reduce pulses and tremors. Another option is radioactive, which destroys the thyroid gland within 6 to 18 weeks after the thyroid gland is destroyed or surgically removed. Patients should use thyroid hormone pills. Natural treatment of hyperthyroidism. Eat cabbage, soy, beans, peaches, turnips. Eating small meals is another way to help the body restore the minerals it has lost due to high metabolism. Foods that are rich in calcium and antioxidants are also very useful for people with hyperthyroidism. Avoid high-fat dairy, red meat and processed products. Consumption of fried foods and sweets should also be limited as much as possible. Seafood consumption and high iodine. Diagnosis of thyroid disorders. If you suspect thyroid dysfunction, you will get the answer by taking a blood test. This test measures thyroid-stimulating hormone, TSH. If TSH levels are high, it indicates that thyroid function is very low, hypothyroidism, but if TSH is low, it indicates that the thyroid is overworked, hyperthyroidism. Doctors sometimes check other levels of blood hormones. In some cases, photography is needed to diagnose thyroid problems. What is thyroid cancer? Thyroid cancer is very rare and is considered a fatal cancer. The main symptom is mass or inflammation in the neck. Only 5% of thyroid masses become cancerous. If thyroid cancer is diagnosed, it can be treated with surgery, radioactivity or external radiation therapy. Complications of thyroid disorders. If hypothyroidism is not treated, it increases cholesterol and the risk of stroke and heart attack. In severe cases, very low levels of thyroid hormone reduce the individual's alertness and severely decrease body temperature. Hyperthyroidism can cause heart problems and brittle bones if left untreated. Thyroid surgery. It is recommended to remove the thyroid gland, which is recommended only if the drugs do not have an effect or if it causes a large goiter. It is clear that after thyroid removal, the patient needs thyroid hormones so that he does not experience symptoms of hypothyroidism. Golden tip. Daily 150 micrograms of iodine is essential for the secretion of thyroid hormones.